Hi, so it's Julien at the Spinal Health Centre. I'm here with Andrew and we're going to run through what would happen if you came in for the first time. So this is our the session we would do the first time you get adjusted. Going to talk you through it. I've also got the rest of the team actually here, so it's an educational thing for them as well. So for those that haven't seen this, so we're all going to be doing some learning together. Hooray! Good. So Andrew, let's have your glasses in there and watch as well. Okay, just pop that up at the top there. So knees about here. I want you to climb up and lie down. Put your nose in the paper there. Okay. These couches lift up. And the way that Andrew got on is actually quite important, because there's a couple of things that we want to ensure happens. One, that his spine is nice and straight as he gets on, because that affects the accuracy of the readings that will be coming up in a minute. The other thing that's important is you'll notice he has his shoes on, and you again get more accurate readings, especially session to session, if you're checking people in their own shoes, because your postural distortion patterns reflect into your shoes. And the other thing is I'll wait a couple of minutes, somewhere between 30 seconds and 5 minutes, closer to 5 minutes the better, just to get gravity off all the load-bearing structures. So when we actually come to do the adjustment thrust, you get more movement through the joint and it actually works better. Okay, so the next thing we need to determine is just to check which leg is the short leg. You should be able to see this quite clearly. You might not be able to see it from there, but you'll see it when I lift up. That he is short on the right, but then as I lift up it looks longer. Is that nice and clear on that image there, yeah? And can you see that it's shorter there? Maybe if you actually come over and just show that, Cameron. So yeah, got Cameron on for camera work today. So again, you see that there, shorter on the right side. It's nice and obvious where I'm obviously looking straight down at it. Good, so if you go back to over there. Okay, so people that will want it to see, if you want to gather in a little bit closer, those who haven't seen, don't worry, you're not going to be on the video. Okay, so we have a right short leg going long on this right side, and both Andrew and I will be able to feel, I can feel there's a lot of tension in his right hip and pelvis, and Andrew actually said to me earlier on he's got actually got a headache that's been going on. Did you say all today or?
A couple of days.
Couple of days, okay. So, can you see? Short right leg, it's at least 1/4 inch there, short to long. Okay, so put a stimulus into the body. We start with the inside of the knee. I'm looking to see if this leg length changes. Doesn't really want to do that, possibly that one, not sure. So we move up onto pelvis, put a bit of pressure on pelvis, and that makes everything go level immediately. Okay, so we have effectively a pelvis that's in an anterior superior state, so up and forwards. So we get the tool, switch it on. I want it on setting 4 here, which is the top setting for moving pelvis. It's a big joint, and we need to put some force through it. There's 3 points of adjustment: onto the sacrum, onto the top of the pelvis, and then about an inch or so up from the sit bone and straight down. Okay, come back and we can recheck that leg length. Has it changed? Actually, that's done pretty good. We'll check the other side of the pelvis. The jab in backside coming up. Going for the sacrotuberous ligament, which is very important in pelvic function. Doesn't seem to do anything, leave it alone. Okay, squeeze your knees together and let go. Okay, so now we move up into testing of what are called isolation tests. So these are motor movements. So it's a command movement, and we're trying to find where the body is trying to adapt, where there's an error in the system, what we refer to as subluxation. So right hand up behind your back. And can you see how he really goes long on the right leg there, arm back down by side. So that's a lumbar 5, we'll come straight to it. So again, setting 4, top of the iliac crest can come across. That one is always lumbar 4, we're on lumbar 5, so that is 1 down. Come across and find the inferior articular process. Got my finger on it there, and I can feel that's possibly a bit sensitive in there.
Yeah.
Tip of the tool in position, 8 pounds of pressure. We deliver the thrust and there's a definite pause. The line of drive is forwards and in. Andrew, did you feel it?
Yep.
Yep. So we know that we moves that bone 1.8 millimeters in 10.4 milliseconds, and the signal that runs up the spine is 3,363 millivolts, and it then has an effect. It actually stimulates areas in the brain, in the cerebellum here, and then in the motor and prefrontal cortex up here. Okay. And does it change that? Yes, it does. Good. Left hand up behind your back. Does nothing. Both hands up behind your back. Does nothing. Both back down by side. Take your right hand up by your face. Big deep breath in and out. Kind of pulls a little bit, but I only get concerned about the obvious, very clear change. Left hand up as well. And then we have a very clear T8, arms down by sides. So T8, set in 3, you could do it on 2. And there is the transverse post of thoracic 8, which is also feeling quite sore. We get into this, we then come across to the rib on the other side and adjust the rib on the other side. Okay, so turn your head to the right. Lift the right shoulder off the couch and back down. Shrug both shoulders up towards your ears, back down. Squeeze the right elbow flat against your side and let go. There we go. See, he's gone short right, long left, so that is a right medial scapula. Squeeze the left elbow in and let go. And there is a left lateral. Shrug your shoulders up and roll them back. That is a typical finding for a right-hander who does a lot of manual work, or in Andrew's case, has been going to the gym and doing lots of weight training. Shrug your shoulders up and roll them back. And head back into the centre. Okay, so I'll just get these shoulders adjusted. So we start into the shoulder blade. And we're going down the shaft of the humerus. And then we're going for the ulnar. Down to setting 2, and then we go into the bones of the wrist, the one furthest away. That's that one. Similar but different pattern on this medial scapula. So this one's gone in, this one's gone out. Tend to tighten up on the dominant hand. Okay, arm up by your face. There we go, I'll show the textbook version of this. And arm down by your side, that's the radius, and then we adjust in to the lunate. Lift up your head and back down. Tuck your chin down to your chest and back to centre. Okay, so cervical 2 on the left, typical with headaches, and yeah, kind of fits with the history. Right, so slight tuck of chin down to your chest. Head back into centre. So up in the upper neck, 2 pounds of pressure on setting 2. And Andrew will tell you he very much felt that, because it very much feels it goes right through, and we know that that increases levels of movement in that upper neck, but also relaxing the muscle, and it's cervical 2 very much goes with headaches. Okay, push your face into the couch and let go. Okay, stretch your right hand towards your right knee and let go. And left hand to left knee and let go. And there we go. And so that is the QL. This big muscle here tends to come up a lot, especially in the early days, or somebody's been clearly working hard. Okay, so in terms of what do we do the first time you come in, we'll run through that. It's called the essential scan, covers all the major junctions. We'll go and adjust as we find, and then we'll get you back in and do more. So that's what you can expect to happen the first time you come in and see us here. See you then.